So my name is Greg Chism, and I'm the Employee Assistance Program Director at Family Service Madison. Family Service Madison is a outpatient, nonprofit mental health clinic with a variety of programs, and Family Service Madison has been in the community since 1910. Stress is actually our internal process that takes place. Stress is not the external event that we are experiencing. External events that can create that stress response can be negative experience like financial difficulties, work-related issues, family demands with getting children to activities. It's also important to note that our internal stress response can be activated by a positive life experience. Planning for a wedding, having a child, a job promotion, a new job, those quote-unquote positive things in our life also can create that stress response. And I also think it's important to note that stress sometimes gets a bad rap. A certain amount of stress is needed for us. A certain amount of stress in our lives keeps us focused, keeps us motivated, keeps us alert. It helps us to perform at an optimal level. I think one approach in terms of managing stress is just simply beginning to prioritize mental health. Because without really good mental health, you really don't have overall health at all. We want to take care of ourselves physically. We want to make sure that we're sleeping well, eating well, and getting an adequate amount of exercise. We want to make sure that we are staying connected to our support systems. Human beings are hardwired to form and maintain interpersonal relationships, so we want to stay connected to our social supports. Well, exercise certainly can be extremely beneficial in managing stress and prevent us from getting from that optimal level stress to that stress overload place. Exercise releases endorphins, the pleasure-seeking kind of neurotransmitters in our brains. It can also help with the production of dopamine, also to help us to improve our mood and to just generally feel good. So exercise can really stimulate a lot of positive things that happens to us physiologically. And in terms of kind of thinking through how I want to begin maybe an exercise plan is, sometimes I use the approach of the acronym SMART, having a SMART approach. The S stands for a specific plan. The M stands for measurable. The A stands for attainable. The R stands for relevant to your own lifestyle. And then the T stands for a timetable in terms of 3 months, 6 months. So when we think of goals and establishing goals for an exercise routine, I think we can use that SMART approach to begin to formulate what those goals look like. Individually, people finding a balance between a variety of different types of activities, whether it be meditation, yoga, physical exercise, just finding a good balance between all those types of activities. The challenge for all of us is trying to find that optimal level of stress.